Cord blood, frequently asked questions. Here at the Mays Cord Blood Bank, we know that there are many questions regarding the potential medical benefits of cord blood and regarding storing your baby's cord blood. Here are some of the most commonly asked questions, along with our answers. What is cord blood? Again, umbilical cord blood is the blood collected from the umbilical cord immediately following the birth of a child. This blood provided nourishment for the baby during pregnancy, but once the baby is delivered, umbilical cord blood is no longer necessary. Umbilical cord blood is rich in multipotent hematopoietic stem cells, or blood stem cells. These cord blood stem cells produce the cellular ingredients necessary for the blood and the immune system. When the umbilical cord blood cells are transplanted into patients, they can help restore the immune and blood systems to help fight diseases and replace diseased blood. What are stem cells? Umbilical cord blood is a rich resource of hematopoietic stem cells. These stem cells are the building block cells of blood, tissue, and organs. They are the earliest cells found in the fetus, which then replicate efficiently and rapidly to create more blood, liver tissue, heart tissue, etc. What are the potential uses for hematopoietic stem cells? Until recently, it was assumed that these hematopoietic stem cells, obtained from cord blood, could only be used as building blocks for blood cells. These stem cells were thought to be useful only in treating blood diseases. If you look closely at the list of current treatments for which hematopoietic stem cells are used, all of them are diseases of the blood. Recently, cord blood research has discovered evidence that suggests that, under the right circumstances, cord blood may be conditioned to change into the building blocks of organ tissue. If that is truly the case, then the potential uses of cord blood stem cells will be extraordinary, including treatment for everything from breast cancer to heart disease to diabetes. If this potential is realized, then saving cord blood can ensure your baby's health well into adulthood. Are there different types of hematopoietic stem cells? There are currently two identifiably different types of hematopoietic stem cells. Pluripotent stem cells are found in the fetus itself, and hematopoietic stem cells are found in cord blood. Pluripotent stem cells that are present in embryos are the most basic stem cells. Since they are so primitive or undifferentiated, they can actually create and form new tissue and new organs. This is what makes them so medically useful. Because they are found within the fetus itself, the use of them is controversial. The hematopoietic stem cells found in the baby's cord blood are different. They are not as primitive as the pluripotent stem cells since they have already started to become blood stem cells. They can, however, rapidly and efficiently create new blood for a patient. The stem cells found in cord blood have been used to regenerate new blood in patients who have blood diseases. The uses for hematopoietic stem cells have grown dramatically over the years. Where can I find more information about stem cell research and potential treatments using stem cells? The following organizations may be helpful: National Institutes of Health Stem Cell Information. The NIH website provides information and resources about stem cells and stem cell research. Please visit stemcells.nih.gov. National Cancer Institute. The National Cancer Institute offers a fact sheet about bone marrow transplants and peripheral blood stem cell transplants. Log on to cancer.gov and search under Fact Sheets under the heading Bone Marrow Transplantation and Peripheral Blood Stem Cell Transplantation. The Health Resources and Services Administration HRSA website provides access to information about bone marrow and cord blood donation and transplantation through the W. Bill Young Cell Transplantation Program. For more information, please visit bloodcell.transplant.hrsa.gov. The Michael J. Fox Foundation for Parkinson's Research provides information about the Michael J. Fox Research Foundation dedicated to finding a cure for Parkinson's disease. Please visit michaeljfox.org. Is the stem cell controversy about cord blood stem cells? No, the stem cell controversy is not over cord blood stem cells. There are two different types of stem cells, and it's important to know the difference. Embryos have pluripotent stem cells, which are the most basic stem cells. They are primitive or undifferentiated, and they are the building blocks for new tissue and organs. They are clearly very useful medically. The controversy over these stem cells is that they must be taken from embryos, and some people believe it is unethical to destroy an embryo for medical or research purposes. The stem cells found in the baby's cord blood are fundamentally different. They are not taken from an embryo, but rather from an umbilical cord, which is generally discarded after a baby's birth. There is no controversy about collecting and storing cord blood stem cells because the cord blood would otherwise be medical waste. Although to date cord blood treatments have only been used to treat blood diseases, there has been extensive medical evidence that, under the right circumstances, cord blood treatments using stem cells could be used to treat a much broader range of diseases. The beauty of using stem cells harvested from cord blood rather than embryos is that there is no stem cell controversy. What diseases are treated? Cord blood stem cells are currently used to treat a number of different diseases. In addition, new cord blood transplant treatments are being discovered all the time. The research is going on worldwide, therefore the field is always expanding. Cord blood banking is becoming increasingly important for the protection of your family. In a moment, we'll provide a list of some of the diseases, including cerebral palsy, where cord blood stem cells may prove helpful in treatment. But first, here's a case study about one of our clients who was treated for cerebral palsy and saw improvement in his cerebral palsy symptoms. Baby John appeared developmentally delayed within the first few months of his life. His dedicated parents pursued his case with his doctors and were soon told that John was suffering from symptoms caused by a pediatric stroke. John received an umbilical stem cell transplant from the cord blood that his parents banked when he was born. Almost immediately, John's parents began to see changes, and over time, in conjunction with traditional therapies, his progress has been remarkable. To hear John's mother tell his story in her own words, please go to mayscordblood.com/success_story.php. In addition to cerebral palsy, the following is a list of some of the diseases where cord blood stem cells may prove helpful in treatment. Leukemias. Acute leukemia. Acute lymphoblastic leukemia, ALL. Acute myelogenous leukemia, AML. Acute biphenotypic leukemia. Acute undifferentiated leukemia. Chronic leukemia, chronic myelogenous leukemia, CML. Chronic lymphocytic leukemia, CLL. Juvenile chronic myelogenous leukemia, JCML. Juvenile myelomonocytic leukemia, JMML. Myelodysplastic syndromes, sometimes called pre-leukemia. Refractory anemia, RA. Refractory anemia with ringed sideroblasts, RARS. Refractory anemia with excess blasts, RAEB. Refractory anemia with excess blasts in transformation, RAEB-T. Chronic myelomonocytic leukemia. Lymphomas. Hodgkin's lymphoma. Non-Hodgkin's lymphoma. Inherited red cell erythrocyte abnormalities. Beta thalassemia major, also known as Cooley's anemia. Black fan diamond anemia. Pure red cell aplasia. Sickle cell disease. Other disorders of blood cell proliferation. Anemias. Severe aplastic anemia. Congenital dyserythropoietic anemia. Fanconi anemia. Paroxysmal nocturnal hemoglobinuria, PNH. Pure red cell aplasia. Inherited platelet abnormalities, amegakaryocytosis congenital thrombocytopenia, Glanzmann thrombobasthenia. Myeloproliferative disorders, acute myelofibrosis, agnogenic myeloid metaplasia, myelofibrosis, polycythemia vera, essential thrombocythemia. Inherited immune disorders, severe combined immunodeficiency, SCID, SCID with adenosine deaminase deficiency, ADA-SCID, SCID which is X-linked, SCID with absence of T and B cells, SCID with absence of T cells, normal B cells, Omenn syndrome. Inherited immune system disorders, neutropenias, Kostman syndrome, myelokathexis. Inherited immune disorders, others, ataxia telangiectasia, Behr lymphocyte syndrome, common variable immunodeficiency, DiGeorge syndrome, leukocyte adhesion deficiency, lymphoproliferative disorders, LPD, lymphoproliferative disorders, X-linked, also known as Epstein-Barr virus susceptibility, Wiskott-Aldrich syndrome. Phagocyte disorders, Shediac-Higashi syndrome, chronic granulomatous disease, neutrophil actin deficiency, reticular dysgenesis. Bone marrow cancers, multiple myeloma, plasma cell leukemia, Waldenström's macroglobulinemia, other cancers, neuroblastoma, retinoblastoma. As you consider this list, remember the treatments made possible with cord blood transplants may one day save your child's life. Where can I find more information about cord blood? Information about cord blood can be found on several websites. The American Pregnancy Association is a national health organization committed to promoting reproductive and pregnancy wellness through education, research, advocacy, and community awareness. Please visit the website at americanpregnancy.org. The Parent's Guide to Cord Blood aims to educate parents by providing accurate and current information regarding cord blood medical research and cord blood storage options. Be sure to take a look at their price comparison information. To learn more, log on to parentsguidecordblood.org. That's parentsguidecordblood.org. Save the Cord Foundation is a nonprofit organization dedicated to making this important decision as simple as possible for parents. The foundation provides unbiased educational information regarding the life-saving qualities of cord blood preservation. Please visit SaveTheCordFoundation.org. That's SaveTheCordFoundation.org. Kids Health offers information for parents about banking your child's cord blood. Please visit kidshealth.org. That's kidshealth.org and search under cord blood banking. Finally, cordbanking.org is a resource for parents offering information about cord blood banking, umbilical cord research, and cord blood technology. Once again, the website is cordbanking.org. What is the potential of cord blood? The future uses of cord blood are not completely known. There's a lot of promising research being conducted, but the confirmed treatments using cord blood are here. Any cord blood bank that claims to understand fully the future uses of stem cells is not being honest. Stem cells are being used to treat a growing number of diseases. The list of blood diseases in which cord blood is used for treatment has grown dramatically. 10 years ago, cord blood was being used to treat only 1 or 2 diseases, but today stem cells are used to treat more than 40 diseases. Cord blood research has discovered some reasonable evidence that stem cells will be able to treat more than just diseases of the blood. Cord blood may be used to treat much more common diseases such as heart disease, breast cancer, and diabetes. These treatments, however, are still experimental. Cord blood research has made treatments using stem cells more efficient. Scientists have designed methods in which they are able to use smaller volumes of umbilical cord blood for larger children. Originally, a cord blood collection could only really help a child who weighed less than 30 to 40 pounds. Now a collection can be expanded to provide enough blood for children who weigh up to 80 to 100 pounds. It is important to note that no cord blood bank has any unique technique or method that allows it to better expand or use your baby's blood. Any cord blood bank that tells you otherwise is misleading you. What is the likelihood we will need the baby's cord blood or cord tissue? Cord blood stem cells are instrumental in the treatment of many diseases, and the list is continually growing. Therefore, the answer to the above question is complicated. Stem cells are harvested from cord blood, which are then used to treat disease. But there is no consensus among experts in the field of cord blood stem cell research as to the probability that your child will need the cord blood stem cells. Cord blood websites show that the probability of your child needing his or her stem cells may range from 1 in 1,000 to 1 in 2. Probably the most honest answer available is that it's estimated that 1 out of 450 individuals will use their cord blood by age 70. That is the number that has been established by non-biased leading experts in the field of stem cell research. If cord blood stem cells are found to be useful in the treatment of common debilitating conditions or diseases, such as heart disease, diabetes, and breast cancer, the odds of the usage will go way up. The chance of your child needing the cord blood stem cells could rise to 1 out of 2. Consequently, storing cord blood is a good way to protect your child's future. How will my baby's cord blood be collected? Immediately after the baby's birth, a physician or nurse will collect 1 bag of umbilical cord blood, which is approximately 150 milliliters or 5 ounces. The cord blood will be collected after the umbilical cord has been cut and either before or after the placenta has been delivered. Therefore, there is absolutely no risk to you or your baby. Additionally, the physician will draw 3 tubes of the mother's blood for testing. You or your partner will notify us that the cord blood collection is done. Then a medical courier will be sent to the hospital. A medical courier will bring the cord blood collection kit containing the cord blood and the mother's blood to Mays Cord Blood Laboratories. Will my doctor know how to collect it? As more and more patients are choosing to collect their baby's cord blood and cord tissue, doctors are becoming increasingly familiar with the collection process. If your doctor has never done a cord blood collection before, it's no problem. Mays Cord Blood Laboratories provides step-by-step instructions in the cord blood collection kit that you bring with you to the hospital. The instructions are extremely simple and can be followed easily by any nurse or physician who performs the collection. Additionally, we would be happy to have someone speak with your physician to familiarize him or her with the process. If your physician is local to Mays Cord Blood Laboratories, we'll be happy to have someone come out and meet with your practitioner to show him or her the procedure for cord blood collection. It will take no more than 15 minutes of your doctor's time. Finally, in the event of an unusual situation or occurrence, our staff is reachable 24 hours a day to answer emergency questions. These phone numbers are included in the cord blood collection kit. Once collected, what does Mays Labs do with my baby's cord blood? In the lab, the technician will reduce the volume of the blood to about 1/4 of the collected volume by removing a large proportion of the red blood cells and plasma, liquid portion of the blood. The red blood cells and plasma do not need to be stored as they do not contain stem cells. Analyze the cord blood to determine how many transplantable cells are present and create a report with this information. This information will be useful in case you need to use the cord blood later. Add cryopreservative, special chemicals to help in the freezing process, to the remaining stem cell collection. Slowly chill the bag at a rate of 1 degree centigrade per minute until it reaches the optimal freezing temperature of minus 130 degrees centigrade, minus 320 degrees Fahrenheit. Transfer the stem cell collection into storage. Run the mother's blood through a wide variety of tests to ensure that there are no diseases present at the time of delivery that could have transferred to the child's cord blood. How will Mays Labs work with me regarding my baby's cord blood? From the beginning, Mays Cord Blood Laboratories will work with you to try to make the process as easy as possible. Call Mays Cord Blood at 877-MAYS-LAB or 877-629-3522 for an information packet or download the registration material from our website. Once you have completed the materials, simply fax them to us at 914-683-0974 and mail them to us at 2975 Westchester Avenue, Suite 3G, Purchase, New York, 10577. A cord blood collection kit will be mailed to you after registration is complete. Cord blood can only be saved at birth, so take this kit with you to the hospital. Your physician or nurse will use this kit to collect your baby's cord blood and draw your blood. Call the phone number on the cord blood collection kit after delivery. Your baby's blood will be picked up by a medical courier within a few hours. The rest is up to us. What are the potential future uses of cord blood? Cord blood research is an extensive field that holds a great deal of promise for the future. Cord blood stem cells may be used to treat many different types of disease, some of them relatively common. Diseases that can appear later in life and diminish its quality, including Alzheimer's disease, heart disease, and strokes, could be helped by stem cell research. Clinical trials are already in progress, testing the potential benefits and side effects of therapy using stem cells. Cord blood is an essential source of stem cells. Stem cell research is dependent upon this resource, which has the potential for treating disease, thereby extending life. Banking cord blood makes this essential resource available for your future use. Cord blood research could find treatments for Alzheimer's disease, breast cancer, Crohn's disease, diabetes, heart disease, kidney cancer, renal cell carcinoma, kidney failure, liver disease, multiple sclerosis, Parkinson's disease, scleroderma, spinal cord injury, systemic lupus erythematosus, strokes, autism, glaucoma. Storing your baby's cord blood may save his or her life one day. What is cord blood tissue banking? Both cord blood and umbilical cord tissue have been shown to be rich sources of mesenchymal stem cells, MSCs. Whereas cord blood is exceptionally rich in hematopoietic stem cells, leading to blood in immunological cells, cord tissue carries a more dense concentration of MSCs. These cells have the ability to differentiate into a variety of different cell types, including bone cells, osteoblasts, chondrocytes, cartilage cells, ligament and tendon cells. Although there are no current medical therapies using stem cells derived from umbilical cord tissues, there is ongoing research for their use in the treatment of diabetes, heart disease, liver disease, and cartilage injuries. In addition to the storage of cord blood, Mays Cord Blood Laboratories is pleased to offer patients the option of storing their child's umbilical cord tissue as well. Once the baby has been delivered by either vaginal or cesarean section birth, the umbilical cord is normally discarded as a waste product. If the cord tissue is to be banked, after the cord blood is collected, the cord itself is clamped. A 3 to 5 inch section is cut and placed in the cup provided and sent to our processing laboratory in the same kit as the cord blood. The cord tissue is minced and mixed with a cryoprotectant, separated into several vials, frozen, and then stored in our cryo tanks until if and when needed. It is not ready for transplant at this stage and must be cultured and expanded when needed. Fortunately, the cells are quite hardy and, based on current research, seem very easy to culture. Although studies are ongoing, there is no guarantee that the cord tissue will be usable in the future. Any transplant need must be determined by the patient's own physician.